Hypospadias is a birth defect where the urethral opening is on the underside of the penis instead of the tip. The underside is also referred to as the ventral side. Surgical repair usually begins at year 1 to year 6 of age. On the other hand, epispadias is a congenital anomaly in which a urethral opening is on the upper side or the dorsal side of the penis. Bladder exstrophy is a complete set of congenital anomalies involving the lower GU tract and the skeletal system. It's characterized as the anterior bladder wall being exposed outside of the body, and the epispadias is usually present as well. The newborn can have a shortened penis, absence of the dorsal foreskin, anterior displacement of the vagina and anus, exposed bladder, neck, divergence of the rectus muscles, and widening of the pubic symphysis. It is not unusual for these patients to have an omphalocele as well. The first stage of repair is closure of the bladder and abdomen. This usually takes place in the first 24 to 48 hours. Bladder exstrophy is a complete set of congenital anomalies involving the lower GU tract and the skeletal system. It's characterized as the anterior bladder wall being exposed outside of the body, and the epispadias is usually present as well. The newborn can have a shortened penis, absence of dorsal foreskin, anterior displacement of the vagina and anus, exposed bladder, neck, divergence of the rectus muscles, and widening of the pubic symphysis. It is not unusual for these patients to have an omphalocele as well. The first stage of repair is the closure of the bladder and the abdomen. This usually takes place in the first 24 to 48 hours. The second stage is to repair the epispadias at 2 to 3 years of age, and the third stage is used to achieve urinary continence, and this usually happens around 4 to 5 years of age. An orchioplexy or orchioplexy, either word is acceptable, is a surgical restoration of an undescended testicle, also known as a cryptorchidism. Testicles are normally retained in the abdomen until just before birth, and then they descend. If they stay in the abdomen, this can result in sterility because of the testicle's exposure to the increased temperature. A patent ductus arteriosus is normal in the fetal heart and usually spontaneously closes at birth when the lungs expand. If not fixed, the heart may fail. The goal of the surgery is to prevent arterial blood from recirculating through the pulmonary circulation. The surgery of choice for repair is suture ligature of the duct. Coarctation of the thoracic aorta is a congenital stenosis or narrowing of the thoracic aorta that leads to not enough blood flow to the lower body. The heart becomes enlarged because of the increased workload, and the lower body may become underdeveloped. The goal of the surgery is to restore blood flow. The patient will be positioned in a lateral position for a thoracotomy. An atrial septal defect is a congenital anomaly in which a hole in the atrial septum allows blood from the left atrium to flow into the right atrium. This is not the normal pathway of blood through a normal heart. This abnormal flow creates increased pressure on the right ventricle and lungs, causing the heart to enlarge and eventually fail. Surgical correction is usually done during childhood. A ventricular septal defect is incomplete closure of the septum between the right and left ventricle that causes blood flow from the left ventricle into the right ventricle into the lungs. This can lead to heart failure. Tetralogy of Fallot is a combination of congenital defects that includes pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy, and dextroposition, a displacement of the aorta. This combination of anomalies reduces pulmonary blood flow and right to left shunting, which mixes oxygenated and deoxygenated blood. This mixture is then pumped into the systemic circulation instead of the normal heart pumping oxygenated blood. Surgical repair is done to correct cyanosis and to restore normal blood flow.